Hello. I cannot think of a time where I have just spoken on here and recorded straight onto TikTok, but there's a first time for everything, and today is that day. I wanted to talk about a realization that I had, and I have a question. I have a question for the chronic pain, hypermobile people, especially girlies that struggle with things like tendinitis and this hypermobility syndrome. Most of all, though, like the chronic pain, because I wasn't always like this. This is a recent thing, and I feel like I need some tips. So, what is the realization that I have had? It is that I cannot do what I did before. And that sounds dramatic, but I cannot train and recover from the training like I did when I was younger. And it's not an age thing, like it's not just because I'm a bit older I can't recover. It's the fact that my hypermobility has got worse. And yeah, I never used to have like this pain. So yeah, I'm having to manage that now. So training does look different, and I need to stop trying to train like younger me. So yeah, that was like today I just had that realization, and it was like, what? Why have I only just realized this today? I guess it's because sometimes I train on autopilot because so I'm a personal trainer and a weightlifting coach, and I have just been in the same routine for years. I dabble, so like I dabble in CrossFit and strongman and Olympic weightlifting, and when I'm dabbling, I'm just always like, I always push myself a bit too far. I can't do that anymore. I need to be more careful, and I know I need to be more careful, but it's very hard to put into actual action and practice. Does anyone else struggle with this? And then I wonder if it's like a neurodivergent thing. So I have a therapist at the minute who is with this charity that's all about like neurodivergence. It's quite cool. It's called Unmasked Neurodiversity. And so I've been matched with a counsellor who is neurodivergent herself, so they understand, and it's to help me organise myself and be a little bit more productive because I'm self-employed. It's been very interesting. So we talk about some autistic traits to do with pain and not realising you're in pain. So like I can really push it at the gym and not realise like this is going to hurt, or like this is too far, or this is gonna hurt like a lot tomorrow. This is gonna result in a flare up. It's also kind of hard to know like how far to push it, because what is gonna cause a flare up and what isn't. Yeah, I just wanted to put that realization out there because I feel like if I post about it and I have truly acknowledged it, I now have to stick to it, and I have to be more sensible and mindful and work on things that I know that'll be good for me, even though it's not at the same level as I used to be at, if that makes sense. Because like I've injured myself quite a few times off the back of the hypermobility getting worse. Yes, this is turning into quite a ramble. How neurodivergent of me. Yeah, I'm after the tips. I'm after tips for pain management, because all the GP says is ibuprofen, rest, and I'm a bit like, but I don't want to rest. Also, my job requires me to be active. I'm helping clients load their barbells and unload them, putting weights away. I need to be able to move and be mobile. So yeah, rest is not always an option for me. So being more careful is. I can go like the opposite extreme where I'm like, okay, I need to be really careful, but then I'm like, now I'm not moving enough at all, and I'm getting stiff and a bit stagnant, and that can make me feel really tired as well. So yeah, trying to find a balance is very, very hard. Is there anyone else out there who is struggling with something like this. We don't know whether it could be hormonal or something. Like, the GP could only help me so far, and then I've been referred to rheumatology, so hopefully that comes through soon, because yeah, we've got nowhere with answers. But yeah, I'll be doing follow-ups, because otherwise this video will just end up being too long. But yeah, looking for the tips.